This is a patient who presents with newly diagnosed stage 4 melanoma with evidence of involvement of the lungs but no other organs, the presence of a BRAF V600E mutation, and a normal serum LDH level. There are many different available treatment options for this patient, including multiple targeted therapies and multiple immune therapies. At this point in time, for patients who present with a BRAF mutation, we actually don't know if the right approach is to treat initially with targeted therapy or immune therapy, as to date there have been no head-to-head randomized trials comparing these different therapeutic approaches in patients with BRAF mutant disease. For BRAF mutant metastatic melanoma patients, a number of considerations must go into the decision about the appropriate initial therapy. It should be noted that both targeted therapies and immune therapies have been shown to work after the failure of the other therapeutic modality, and so we tend to emphasize with patients in this situation the multiple different therapeutic options that are available to this patient both at this time and in the future. In terms of picking the initial therapy, we often will evaluate the aggressiveness of the disease that the patient has. What are the size of the tumor burden? What is the extent of site involvement? And what is the serum LDH values? With higher tumor burden, higher extent of disease, and higher LDH being consistent with a more aggressive disease and therefore probably necessitating more aggressive treatments. For patients who actually have low burden of disease and normal LDH, we know that those patients have very good outcomes, whether we use targeted therapies or immune therapies. We also will consider the comorbidities of the patients, as there are certain factors which will push us towards or away certain therapies, such as the presence of coexisting autoimmune conditions, which may cause us to move more towards using targeted therapies as compared to immune therapies. And finally, specifically as we think about different immune therapy options for this patient, we may consider things like her comorbidities and her social support structure, as we know that certain immune therapies like PD-1 have a very low risk of toxicities, but other therapies like the Ipi-Nivo combination have a very high risk of toxicities and therefore are safer to give in patients who have a good support system in place.